a tropical plant sold alongside energy drinks and rolling papers, is quietly activating the same neural circuitry as some of the most addictive substances on Earth. Kratom, derived from the Mitragynna speciosa tree native to Southeast Asia, contains over 50 alkaloids, but two of them, mitragynine and 7-hydroxymitragynine, bind directly to mu-opioid receptors in the brain, the very same targets that morphine and heroin exploit. The U.S. Food and Drug Administration awarded a grant in September 2024 for a formal human abuse potential study, acknowledging that no well-designed trial has yet determined whether kratom produces the rewarding high that drives compulsive use. A 2024 meta-analysis found that natural kratom leaves contain only 0.01 to 0.04% 7-hydroxymitragynine by dry weight, yet this minor alkaloid demonstrates substantially greater mu-opioid receptor potency than mitragynine or even morphine itself. What makes kratom neurologically deceptive is its dose-dependent duality. At low doses, mitragynine activates alpha, two adrenergic receptors, producing stimulant effects that feel like a strong cup of coffee. At higher doses, the opioid receptor activity dominates, shifting the experience towards sedation and warmth. A direct observation study conducted at the National Institute on Drug Abuse found no respiratory depression after kratom self-administration at servings, up to 10.9 grams, suggesting the overdose mechanism differs from classical opioids. However, tolerance builds rapidly. Withdrawal symptoms include sweating, nausea, muscle aches, and insomnia, and the brain begins requiring the substance for baseline functioning. The shortest high in recreational drug use may carry the longest consequences. Nitrous oxide, the same compound dentists use for sedation, floods the lungs and crosses into the bloodstream within seconds when inhaled from whipped cream canisters or balloons. It blocks NMDA receptors, producing a brief wave of euphoria, muffled sound, and a sense of weightlessness that vanishes in under a minute. Because the experience is so fleeting, repeated inhalation in a single session is the norm, sometimes dozens of times. Each repetition starves the brain of oxygen. A 2024 study published in BMC Neurology documented 7 patients aged 19 to 32 who developed acute myelopathy and sensorimotor polyneuropathy after chronic nitrous oxide use, with short-term recovery proving generally unfavorable. Nitrous oxide oxidizes the cobalt ion at the core of vitamin B12, rendering it unable to function as a cofactor for methionine synthase, an enzyme essential for maintaining the myelin sheath that insulates nerves throughout the brain and spinal cord. A 2024 paper described nitrous oxide inhalation as rapidly emerging as the leading cause of functional vitamin B12 deficiency. Standard blood tests can show normal B12 levels even while the vitamin is functionally inactive, meaning many patients receive delayed diagnoses. Elevated homocysteine and methylmalonate levels are more reliable markers than serum B12 alone. The gas that promises 30 seconds of laughter can quietly dismantle the nervous system over weeks of repeated use. Some of the most accessible dissociative experiences in the world sit behind no locked cabinet and require no prescription. Dextromethorphan, the cough suppressant found in dozens of over-the-counter syrups, converts in the liver to dextromethorphan, which blocks NMDA receptors with a mechanism remarkably similar to ketamine and PCP. At therapeutic doses, it suppresses coughs. At doses many times higher, it produces full dissociation, closed-eye visuals, and a sensation of watching oneself from across the room. The experience is colloquially called robo-tripping because movements become stiff and mechanical. Tolerance builds rapidly, and heavy use has been associated with memory problems, liver damage, and potential brain lesion formation. Phenibut was developed in the 1960s for Soviet cosmonauts to manage anxiety without cognitive impairment. It requires a prescription in Russia but is sold legally as a dietary supplement in the United States. It crosses the blood-brain barrier and enhances GABA, the neurotransmitter responsible for calming neural activity, while mildly stimulating dopamine receptors. The peak lasts 6 to 8 hours and feels like functional calm without sedation. But tolerance develops within days of regular use, and the withdrawal syndrome rivals that of benzodiazepines. Severe rebound anxiety, insomnia, tremors, rapid heartbeat, and in extreme cases, hallucinations and seizures lasting weeks. GHB enhances GABA activity and triggers dopamine and growth hormone release. But the difference between a euphoric dose and an overdose can be as small as half a milliliter. Australian research published in 2024 found that GHB-related deaths increased 12-fold between 2013 and 2022. And unlike opioid overdoses, there is no reversal agent available. A single tab of blotter paper can contain one of the safest psychedelics ever studied, or one of the most lethal. And there is no way to tell the difference by looking at it. LSD has no documented fatal overdoses in its entire history. 2,5-I, NBOME, a synthetic compound frequently sold as LSD on identical-looking blotter paper, has been linked to at least 19 overdose deaths in the United States alone. Both substances activate the 5-HT2A serotonin receptor, but NBOME does so with an aggressiveness that can trigger seizures, dangerous spikes in heart rate and blood pressure, and fatal cardiac events from a single tab. Research found that 2,5-I, NBOME crosses the blood-brain barrier easily, accumulates in brain tissue, and causes oxidative DNA damage in the frontal cortex and hippocampus. 2,4-CB, a synthetic compound created in the 1970s, binds to serotonin receptors to produce visual hallucinations and emotional warmth, with experiences lasting 4 to 6 hours. However, active doses are measured in milligrams, and a few extra milligrams can convert a manageable experience into hours of overwhelming sensory chaos. PCP, originally developed in the 1950s as a surgical anesthetic, but abandoned because patients awoke agitated and psychotic, severs the connection between sensory input and emotional response by blocking NMDA receptors so completely that physical pain ceases to register. The dissociation can persist for days, accompanied by paranoia, aggression, and persistent psychosis. Salvia divinorum, legal in many jurisdictions, activates kappa opioid receptors rather than serotonin pathways, producing a 5 to 10-minute experience so bizarre that users report believing they have become inanimate objects. Each substance demonstrates that receptor specificity, dosing precision, and individual neurology interact in ways that no casual assessment can predict. Ibogaine, extracted from the root bark of the African iboga plant, interacts simultaneously with serotonin, dopamine, and opioid receptors during experiences lasting 24 to 36 hours. Users report watching their lives replay in vivid detail, confronting buried trauma, and emerging with opioid withdrawal symptoms dramatically reduced or eliminated. A 2024 study published in Nature Medicine found that magnesium ibogaine therapy produced significant improvements in PTSD, depression, anxiety, and cognitive function in veterans with traumatic brain injuries, with effects sustained for at least 1 month. In December 2025, Texas allocated $50 million for the first major U.S. clinical trial consortium, evaluating ibogaine for addiction and related conditions. Yet ibogaine is cardiotoxic. It can cause irregular heartbeats, and deaths have occurred, particularly in individuals with pre-existing heart conditions or those treated without medical supervision. This tension between therapeutic breakthrough and cardiac risk defines the current moment in psychedelic medicine. 5. MIO, DMT, extracted from the venom glands of the Sonoran desert toad, or synthesized in laboratories, produces what many describe as the most intense psychedelic experience known: a 10 to 20-minute dissolution of identity, memory, and awareness so complete that users report merging with the universe or being erased from existence entirely. In 2025, the FDA granted breakthrough therapy designation to an intranasal formulation of 5-MeO-DMT after a phase 2b trial demonstrated rapid and sustained reductions in depressive symptoms within 24 hours, lasting up to 8 weeks. Mephedrone, the synthetic stimulant that floods the brain with serotonin, dopamine, and norepinephrine simultaneously, stands as a cautionary counterpoint. Its compulsive redosing pattern and devastating serotonin depletion demonstrate what happens when neurochemical manipulation occurs without therapeutic intent. The brain's capacity for transformation and its vulnerability to damage are, it turns out, two expressions of the same underlying plasticity. Thanks for watching. If you have anything to add, drop a comment below. Don't forget to like and subscribe for more videos exploring the world around us.